Hello, everyone. I hope you are doing well. So, this is week 5, and just to let you know, we're going to be doing some stats work this week, and we're going to be using OpenEpi. So, probably the easiest thing to do at this time is to go to Google and type in open space epi and click on OpenEpi and get to this screen because we're going to go back and forth between the PowerPoint presentation here and OpenEpi in order to show you how to do some stats. Now, I know that Rocky Mountain has you use Intellectus. And from what I understand, because I have not used Intellectus with my research analyses or my statistical analyses for my research studies, I use SPSS. And from what I understand, now I may be incorrect, but this is the feedback I've received in the past, that it is either not easy or Intellectus doesn't have measures of risk in it. So that being said, what we're going to do is practice using OpenEpi. If you go on to do something with epidemiologic methods as part of your dissertation in the future, it is really easy to use SPSS. I have a student that I am chairing right now, and he is getting ready to do his proposal defense at the end of the month. Not his proposal defense, excuse me, his final defense at the end of the month. And he has been using SPSS. OpenEpi, it is a great way for us to practice and to, if you don't have access to SPSS, for us to be able to kind of see the stats in motion. So let's go through things here. And many things that you have done in some of your biostatistics class already are going to be things that are important within any type of epidemiologic study that you do. Summarizing data, for example. Data exists as either numerical or categorical variables. And so numerical variables include like counts, like the number of children per age, or measures like height or weight. And categorical variables result from classifying. So, for example, categorizing by blood type, like ABO or AB. So you may, within an EPI paper, summarize data. Tables and graphs are very important. As we saw going back to, I think, week number 1, looking at the map that was used to track the cholera outbreak in London. That's a way to visualize things. For us, the majority of us are going to be doing stuff that is not related to epidemiology, like tracking disease, how it's spread. We epidemiologists were rock stars during the pandemic. We were learning that you could potentially identify the incidence of COVID within a community based upon looking at how much COVID could be found in the wastewater. So it's most of us are not going to be doing those types of things. We're going to be looking at risk factors related to the onset of injury or disease. We're also going to be looking at how potentially different factors could help to reduce the risk of disease or injury, or how different things could lead to positive changes or positive outcomes. So when we're talking about tables and graphs, we're looking at a way to display data that can be quickly viewed and easily understood. Each table and graph should contain enough information so that it can be interpreted without reference to the text. And that's key. So that gets into how you label things. Titles should be carefully crafted to describe what the numbers in the cells represent, how the cells are classified, and where and when the data was collected. So here is an example of a table. This is from Smith et al. from a top-tier journal, Medicine and Science in Sport and Exercise. And so what Smith et al. Did is they had people perform the Y balance test. Now, I know many of you may not be familiar with it. That's okay. This is a test that has been popularized as of late. And actually, it was created by a graduate of Rocky Mountain University. His dissertation looked at using tape on the ground, the star excursion balance test, but what he found was individuals, these high school athletes, if they had poor scores in the shape of the Y, as shown here, that led to a greater risk of injury in that athletic population. So Smith et al., they did a study looking at collegiate level athletes, and what we're able to see here is the demographic data. So this gives us information looking at the comparisons between those who were injured and those who were uninjured during the course of the study. And what's interesting is if we just look at the asymmetries in how far they reach. So, for example, the woman here is demonstrating the anterior reach where you slide the block forward, and that's performed bilaterally. We see that there was not a difference statistically between the injured and uninjured individuals. So here is a table that I published in the Journal of Sport Rehabilitation. And this is again showing demographic information. And I have it laid out a couple different ways. So I've got a column here for all the volleyball athletes. And what I'm trying to get across to you is even though we're not calculating or demonstrating risk yet in our presentation, we're informing the reader about the sample. So here are the volleyball athletes, all 82 in the study. You get an idea about their demographic information as well as their functional performance test measures as a percentage of their height. Then we get a comparison of athletes who were not injured during the season versus athletes who were injured during the season. So interestingly, if we look at the injured versus not injured individuals, there was no difference in test performance. What becomes valuable is when we really dive into the data and we look for differences based upon, in this particular case, test performance on all the tests. There was only 6 people who performed poorly on all the tests, but those 6 people, look at the statistical differences here. So I used an independent t-test to compare the scores in the referent group or the reference group. This is the group that we would consider to be at a lower risk of injury versus those in the at-risk group. Big statistically significant differences there between those individuals. Going back to Dr. Phil Plisky, who was a graduate of Rocky Mountain University, this another example of presentation of baseline characteristics of the high school basketball players that he evaluated. And we see the breakdown between individuals based upon sex, and we see the total population. So again, the key here is presenting that demographic information. Sometimes it is just numbers and percentages of the overall population, and sometimes we're looking at mean scores. Here is another table from Powell et al. We looked at Powell et al., I think back in week number 3. And in Powell et al., this is illustrating injury rates. And in this particular situation, again, a lot of these examples I have are sports-related examples, but you could look at an injury rate, you could look at a disease rate, you could look at a particular outcome in a population that you work with. So, for example, I know we have a lot of speech language pathologists in the class. Forgive me, I do not really know anything about the populations that you work with, meaning I'm just ignorant. I don't know. So you could have a particular population, let's say individuals with a stroke, and you may be interested in, it doesn't always have to be injury rates or disease rates. You could be interested in the rate of a particular presentation in individuals with a certain type of stroke. What this table is illustrating for us is when we're looking at data for men's and women's sports of all levels, this has got everybody mixed in. Actually, this is men right here. I'm sorry. This is men here in this part. The injury rate per 1,000 exposures, and exposures can be like athletic exposures, person time. It all depends upon how you want to define it. So, like an athletic exposure could be every time an athlete participates in a practice or a game. You could have person years. We had examples, I think, early in the term related to cigarette smoking. And so, calculating in the large population that they were working with there, the years of smoking that somebody was doing. So here we've got, with the male athletes, we see an injury rate of 27.8 per 1,000 exposures. And they break it down. The non-time loss injury rate is 21.8, and the time loss is 6.0. And this is always important as you look at things to really define things, and it makes things objective. Whatever your professional background is, the more objective you can be helps you then express why something is important. So, to give an idea here from a basketball perspective, what's a non-time loss injury? Could that be that somebody is experiencing a calf muscle strain and is receiving treatment for it, but it is not keeping them from playing sport? Whereas a time loss injury could be something like a back pain episode where they're having spasms and they're unable to play because of the severity of the pain. Here's a nice example of a bar graph. Again, a great way to illustrate, in this case, the percentages of musculoskeletal injury in a population. And as I did mention a little bit earlier in this lecture, here is the example of a map, spot map here showing the deaths from cholera in London. That was useful for John Snow when mapping that in relation to the location of the water pumps. On the next slide, I think we've got a rate map. These are slightly different in that geographical areas are shaded according to the differences in values. So here's a rate map example, intentional homicide rate. And so based upon the color, we get an idea about the potential danger in a location based upon what color is being presented. And this is really interesting up here when we look at Greenland. Like, what's going on in Greenland? Is that really a thing going on there? And then, of course, these can be found, I think, still on the CDC website as they update things. But this is an older one here. A lot of COVID-19 rate maps were being presented throughout the pandemic. So again, another example there. And then, so here was like an example for cases in the last 7 days. These are all ways for people to get an idea how the disease is spreading, what is the concentration in an area. So here's the cases per 100,000. And this is an interesting one here too. And I really like this one. And since I'm not in, well, here, I could probably show this. This is a cool one because it shows changes over time. So let me go to slideshow. And so now what we'll see here is the change in the prevalence of self-reported obesity. And again, highlighting, making sure that we know that prevalence is, again, looking at a snapshot at a point in time. And you can do those snapshots repeatedly. So they're not saying what are the new cases of obesity, because if you did new cases, you would not be capturing everybody that had obesity at the time the data was collected. But really, this is kind of an interesting analysis here, an interesting presentation because it shows the progression, the worsening, and it starts to make you come up with like ideas like, hey, what could be going on? Especially as we look at certain parts of the country, you start to wonder, okay, is there the need for potential education services related to diet and exercise? What is going on in those areas which could help population health? Line graphs can also be valuable, showing a change or difference in a variable. And so this one here from a paper by Mitch Rao and looking at initial injury rates during the first month of the cross country season among girl and boy high school runners. So, why is this potentially valuable? What's an initial injury? An initial injury is what is used for determining risk. Sometimes people get injured the second and third time through the season, but that's not increasing the general risk of the population. That's just that individual having subsequent injuries. So in this case, looking at initial injuries, and it gives you an idea as the season is progressing here during the first month, we're seeing an increase in injuries starting at week 3. So what does that tell us? Well, we can start to speculate things. Just like a few weeks ago, I was having you speculate potential causes of injury in the Division 3 athletes. So if we see these patterns, it opens up the potential for either future study or in some cases, maybe not a study, but the coach going, hey, something's going on here at week 3. Do I need to back off my training? Do I need to change my training? Do I need to have my athletes coming into the season better conditioned prior to the season getting going? And here's another example of a line graph here showing the injury rate in athletes, college athletes, comparing game and practice rates over the 12, 14-year period. Pie charts. This was a paper that we did looking at patellar tendon abnormality, and it was published in the Journal of Athletic Training. So what we were able to show here is, in general, most people, the majority, had no abnormality at the start of the season. But then we see that there were individuals that had it on the right and the left, and then some people, a small sliver, also had it bilaterally. So again, it gives you that quick view of, in this case, the prevalence of that preseason patellar abnormality. Frequency distributions and histograms. Again, another way we can organize data, and it may be appropriate in some situations. All right, I'm going to, let me check and see how far we've gone with this particular one here. Oh, yeah, 18 minutes. Let's go ahead and let's stop this one here so you can take a break, and then we'll get into the good stuff.